Dr. Alejandro Badia here for another bi-weekly episode of Fixing Healthcare from the Trenches. And honored to have a guest who's really trying to attack healthcare from a segment that we all know is critical, which is the employer. And we will maybe touch on the history of that briefly. Mr. Carl Schuessler founded Mitigate Partners, which is an organization really directed at bringing large employers the tools to be able to really save on healthcare costs and also provide better care, which obviously as a physician is what I'm interested in. But I also know that good, especially specialized healthcare, really is the most economical. And we'll be talking about that. He's coming to us from Atlanta. I know he grew up in Macon, Georgia. He has a bunch of interesting hobbies, very dedicated with his kids, but I know he's very dedicated to this issue. And I'm honored to have Carl on the show. Thank you for coming, Carl.
No, Dr. D, it's a pleasure to be with you today. So thank you for having me.
So tell me a little bit about when you really focused on the fact that employers need to lead the charge in bringing healthcare, to some sense.
I would say, Dr. D, it was probably February of 2013. I was coaching my son's middle school baseball team, and I got jacked up in the face with a baseball. If it had been a middle school kid, they would have had their face rebuilt 5 times, I was told. But because I'm a stubborn old fella, I didn't have to have any surgery done, but I did go to the emergency room. But it really all started there, all honesty. It was February of 13, I'll never forget. And as my face went through the Jerry Garcia, looked like a tie-dyed T-shirt for the next month. Wow. Never had a headache, though. They did prescribe me Percocet, which I never took, and I didn't even realize about opioids then, but I did not take it. But anyway, I apologize. I can go all over the place, so I'll try to bring it back. But I read Time Magazine.
That is another topic that we need to touch on at some point, obviously, the opioid crisis, and it does affect employers and obviously patients and their families. So I'm glad you did mention that.
Yeah, it was Time Magazine article, February of 13, and it was Stephen Brill's Bitter Pill. It was the longest article in the history of Time Magazine. And that's really kind of where I had like an epiphany, is things were uncovered and shared with, well, how can a bag of saline cost $400 yet it cost the hospital $3? Things like that. And I kind of sat there, I go, golly, I sure dadgum thought it was like that. Something was wrong. And I kind of went down a different path, really at that point forward, that kind of led me to where I am today. There had to be a better way to give better care and at the same time reduce costs for both the employers and their employees. And we kind of went, that's it. I just, unlike a lot of people in our profession that we call brokers, as my friend Rich Haney says, brokers make you broker. We're benefit advisors, and we're very different. And I always was looking through my whole career of ways to do things differently. We were out in front on high deductible health plans with HSAs before it was cool. We were doing all that stuff, but that's just how I was built. But at that point, we went a totally different path, and it led us to where we are today.
That's wow. That's interesting. So you folks are the ones to also speak to about HSA's health savings accounts.
Say that one more time, Dr.
I said that you folks are also the ones to speak to, apart from employees in terms of health savings accounts. You're also the experts on that.
Well, yeah, I'll give you an opinion on that. I was just saying that we were doing that before it was cool. I'm going back to 2006. Yeah, before it was popular. We always have been on the cutting edge of ideas and are willing to try things for the betterment of our clients and their employees. But I'm glad to give you some thoughts on the HSAs. They're wonderful. High deductible health plans are wonderful programs if the employer is going to fund the health savings account. But if the employer is not going to fund it, which 99% of them don't, it leaves the employee who doesn't have, the majority of Americans don't have $500 in their checking account, Dr. Badia, and therefore putting them on an HSA platform where they got no drug copays, no low cost, no low out of pockets. They're scared to death to use their health plan. So what you have is basically a functionally uninsured country that's buying these programs, and it's making things worse, not better. But again, if I get you, Dr. Badia, your practice, or physicians or anyone that do earn a good living, they can take advantage of the HSA. But unfortunately, employers don't help them put money in that account.
Let's understand this, because I'm not only a surgeon, what I call a reluctant healthcare entrepreneur, because it's darn hard. But I also obviously have a number of employees, right? And we have an excellent team. So just in my own practice of Badia Hand and Shoulder Center, we have quite a few people, and the staff has always been very resistant about going without insurance. But I'm willing to fund it, and I don't understand why employers wouldn't do that when they can potentially get better health care, and those dollars are being spent to their employees and paying the actual people who provide health care, right? The physicians and nurses and the technicians, rather than some gleamy, shiny building called United Healthcare, who has 250,000 employees, right? So why do you think that employers have been reluctant to do this when we are already, now that I'm in September, we're deciding on our health plan for next year?
Well, a good question. We'll make sure I'm clear on what you're asking. Are you asking about the health savings account, why employers aren't doing that particularly? Yes. Okay.
Considering that that most employers correct pay for their employer-based health plans, right? Most, I have a broker, as you said, and I know how much money they make, because a friend of mine is a critical care and recovery room nurse, and became a health insurance broker. She makes much more money than saving people's lives. So you're shaking your head. Our system is so broken, and that's why I'm doing this. So
something bad wrong. Here's the deal, Dr. D. Okay.
Yeah.
When you got an employer, let's just pick 100 employees. Okay. Yeah. For them to fully fund an HSA for that 100 people, and if they got a family or they're employee only or whatever they are, that's extra money that the employer has to put in that plan, plus pay the premiums for the health insurance that goes with it. And it can get costly. And the whole point that I'm getting to here is, if you're going to do an HSA high deductible health plan, you need to put seed money in that HSA account for the employees. Most Americans don't make much money at all. Like I said,
I get that, but I think what I'm getting at is, the fact is that when I speak to my employees, they end up paying money anyway when they go to their physicians. I'm thinking, me as a physician, I love when a patient says, I don't have insurance, but I recognize that this is almost as important as, my plumber or my electrician or my lawyer's bills. So I'm just going to pay you like any other. Now, it gets expensive, of course. God forbid that employee, gets hit by a bus, right? And then, they have to be hospitalized, or they come, they're diagnosed with a malignancy, a cancer. And we understand. But at that point, that's when these insurance plans should kick in, right? But I would rather pay for my employees, and I do this for myself. When they go to a physician, we do that with a dentist, right? The dentist rarely works with insurance. I would rather just pay that. Why do you think that we haven't been able to get to that level in our society?
Okay. All right. Great question. So we'll shift away from the health savings accounts. And by the way,
but it's integral to it, isn't it? Isn't it integral?
Well, it can be and it can't be. It really depends on where you want to go. My wife and I have an HSA plan for our family of 5. We do. But we can afford, been very blessed to have some good clients that believe in what we do. So we can afford to fund the HSA, and we're okay. But it still doesn't take out of the account that you're putting the employee in America, the average American, to try and go figure out what Dr. Badia charges for a total knee replacement. Right. What's the cost of Dr. Badia charges X? Well, then I got United Healthcare. Then what's that cost? It's a very complex thing. Right. You look at things. So what insurance did, what really happened in the late 80s, is that there was healthcare and there was insurance. and they merged healthcare and insurance. Now we have health insurance, and all the copays and all the other things masked the real cost of what care was.
Right.
And on top of that, when we put in, the reason employers did the HSAs, Dr. Badia, was because at the time when they did it, the health insurance companies were charging a lot less money for them. But now that premium is so dead gum high that we build plans. We call them employer-built plans at Mitigate Partners, not insurer-built plans. So it's Badia Hand Institute-built healthcare, not United Healthcare.
Right.
Okay. Right. And we do that, but a lot of our plans have no deductibles. We remove the barriers to care. The reason the country's getting sicker and sicker and sicker is because the deductibles are getting higher and higher and higher, and they're already bankrupt before they ever go to the hospital and open the door to the ER. They're bankrupt. And that's the problem. So you have to change that and remove the barriers to care, which we do in our programs. We found that the richer the benefits, it actually lowers the cost.
Wow.
By the way,
yeah, I mean, wow. This is yes, because it's what I said when I first went on, is that the reality is that the right healthcare I'm giving away one of my points that we'll discuss in a few minutes, but that ends up saving money. And this is a problem that we need our society to understand. And and even the health insurance plans. So we have to, those of us who are in the trenches need to be able to communicate with the insurance plans, right? But we don't have that. That part is completely broken. Right. So will Mitigate Partners make that bridge?
Yeah, well, Dr. D, it's a great point you make. I mean, let's be honest. My dad was a 49-year private practice OBGYN in Middle Georgia. Okay, retired in January of 15.
God bless him.
Yeah, I'm telling you. But he retired January 15, and I'll never forget. He told me this and that some things stick with you, Dr. Badia, when you're a young little punk like I was at the time in high school. But I remember. Right, it's about the time I was going to college, and when managed care entered Middle Georgia, because everything gets there last, but it entered Middle Georgia. He said, I'm not going to sign up for any insurance company PPOs. I'm not doing it. Our practice isn't doing it. We're not doing it. I get this principled nature from him, I guess. So the passion and the energy is probably to blame for my father, but he didn't do it. So Dr. Badia's wife came to see him one day, who'd been seeing him for 20 years. And she said, Dr. Schuessler, I can't come here anymore. Oh, did we do something wrong? No. You're not my network. And he came home and said, Dad, he said, son, it's over. Mark my words. This is the decline of healthcare. And boy, I tell you, he nailed it at that point. So the point I'm making is we can restore that back. My doctor, my choice. Why do we need networks? I ought to be able to go wherever the heck I want to go. And that's what we do in our plans. And again, I'm sorry, I get fired up.
No, we're on the same page, man. This is
we do direct. We work directly with hospitals, doctors. Right. We do that in our program, and the doctors like our plans because we're generally paying them $150 of Medicare North, depending on the specialist, and they're getting 110, 120 from the insurance company. So we want to take care of the doctors because they're integral to this being a patient-centric system. Right. They're the most important for me. I'm just telling you, for me, I'd let you operate on my desk with being an orthopedic surgeon. I don't really care about the hospital as much. Right. I care about the doctor taking care of me and that care team that's taking care of me.
Yeah.
And that's the decisions we make in our plan. So we let people, we steer, we have nurse navigation. They look into, and again, it's not perfect, Dr. Badia, but we can look into the outcomes, the complications, lawsuits, whatever it is, physical therapy, whatever the metric is, we can look at that and try to help steer that member to a good doctor. Or if we have a direct relationship with a Dr. Badia who's got an outstanding reputation, that's not a problem. And you don't have to do it. We'll pay you on the spot or 30 days before the surgery. We don't have all these problems. So you don't get paid for 90 to 120 days from United Healthcare, I guarantee you.
Oh my God, no, it's but the problem is, Colin, this will go to my second point. We're getting to that point in the show because we're definitely going to go over. My goal is always 15 to 20 minutes on these because people have a lot of bandwidth.
We need to do 4 parts. We'll do a 4-part series.
There you go. I'm going to ask you an interesting question. So employers also have a big segment, right, called workers' comp, right? Workers' comp, and people think it's only just manual workers who get hurt, and I'm a hand surgeon, so I see this all the time, right? I mean, saw injuries and punch presses and okay, but there are work comp claims in every sector. People make a claim because they think they develop carpal tunnel syndrome, a common compression neuropathy, a pinched nerve in the wrist, because they're typing too much. Huge myth, but that's another point. The issue is, why is it with an employer we can't have a direct relationship? Because at least in Florida, when they put a claim, these patients go through multiple steps, okay, to be able to get to the right person who can treat them, and a lot of money gets thrown away during this process. So I started, we follow each other on LinkedIn, and that's the reason why this happened, right? So you've seen our Ortho Now model. We try to go to big employers, the biggest ones here in Miami area, and we said, look, if you're, we're doing a lot of construction here, right? If your best sheetrocker or roofer or plumber gets hurt, we have a walk-in center where you're going to start with somebody who knows orthopedics, not an occupational health doctor, not a not a primary care doctor working at an Occ Health Center. You're going to see somebody. Why do you think it's been so difficult to be able to communicate with the employers or even the work comp companies to be able to save them money? Where do you think the barriers might be?
Well, that's a great question, and I know, depending on time, my answer would be, my co-founding partner, Mitigate Partners, Barry Murphy, and I kind of back along those 10 years ago started looking at the deficiencies in healthcare that we saw from our side.
Right.
And I'm glad to call them out to you. There's 6 of them that we identified. So what we do for employers is turn those 6 deficiencies into opportunities for the employers.
Right.
But you got to understand, number one of those 6 deficiencies is embedded conflicts of interest, i.e. the cartel. Okay. And the cartel is the insurance companies, the PBMs, you may have heard, pharmacy benefit managers.
The PBMs, yes.
We call them program bilking millions. All of those out there, some doctors, not many, but there's a component. The brokers, the folks in our business, it's all in together. And when you ask that, they don't want the cost to go down. The only person that wants the cost to go down is the employer. Everyone else is sitting there I want you to envision this conference room table in an office, and you look out the window, and what do you see? United Healthcare, Advent, Daytona Speedway, Advent Hospital, Advent Health. I mean, what? That's because they're charging low amounts for people to come there. That's how they can sponsor all these events, right?
Right. Well, and a lot of them don't pay taxes.
Right. But you got these conflicts of interest,
right.
And no one wants the cost to go down because it hurts hospitals, insurance companies, PBMs. The cost, that hurts them. And our model, we don't work with insurance companies. We eliminate the middleman,
right.
And eliminate all the barriers that the doctors hate. We can even waive pre-certs in certain cases and build plans to do that. The physicians, I've spoken to many physician audiences, they love it. But, we can do that. So we eliminate that and let doctors get back to practicing and taking care of patients. That's how you have to make this work. But when you have that insurance company, Dr. Badia, that's why you got this rub that you're dealing with, because it
just sucks out so much money from the overall, and that's why our healthcare is twice as expensive, per in terms of percent of GDP, and even per capita
100%.
is twice as expensive as the next country on the list, which is Switzerland. Not exactly a third world country, right? This is exactly the reason. So,
hey, listen, real quick. Only what the studies have been shown, only about 27% of every dollar spent on healthcare, 27 cents, gets the clinician who's taking care of the patient.
Right. And the other, and I think is it almost 60% going to, big hospital systems, right?
And we've been successful talking with hospitals, working directly with them, not always in a direct contract, but in a way with one of our fair cost health plan partners that holds the contracts. So it's not, it walks and talks and squeaks and squawks like a direct contract, but technically it's not, because the employer and the hospital don't sign the same piece of paper. But we build it that way, and we pick hospitals that have good outcomes, good quality metrics and everything. And that's where we try to steer the patients to. And the same with surgeons or anything like that. And if we've got the partners like you, or, I told you we spoke at the Ortho Forum, or groups like that, where we know they're good groups, we can absolutely do it. Because in our model, Dr. Badia, there is no insurance company. There's an independent third-party administrator, and they're going to really do what we tell them to do. We're the architects of this health plan. We're building it. Again, number one goal in mind is an employer-built health plan, not an insurer-built. And we do that and eliminate that. So we.
And you guys and Mitigate works around the country?
Yeah, we do a lot of work in Florida. Yeah, that's the post you wrote with me, was that DeSoto Memorial Hospital, where we referenced the $64 per beneficiary savings that the ACOs generated in 2019. And little old boy from middle Georgia, in the middle of Arcadia, Florida, I didn't know where it was until Dr. Lee Gross introduced us to DeSoto Hospital. I never heard of it. Yeah. $2,420 per beneficiary versus $64. I don't know, man. You go figure.
Yeah,
but I will tell you. The reason you're having trouble in Florida, I'm sorry, I get fired up.
Yeah, no. There's trouble all over the country, as you know. But normally this podcast, we don't often get into that sort of granular, like, let's do some work together. But it's an educational thing, and but definitely we need to talk, and hopefully a lot of the people listening will say, you know what, I got to call these fellows and Mitigate.
Here's another good thing, Dr. Badia. The reason you probably had trouble in Florida, in that part of Florida you're in down there in South Florida, you're dealing with the biggest hurdle to this working, quite honestly, the absolute biggest hurdle is the broker. Because if you go talk to an employer, you've got a friend that runs a widget company with 300 employees. And you go talk with them, they know you, they like you, your kids play sports together, y'all sit on the church pew together, whatever. You talk to them, and, oh, we love this. This is great, Dr. Badia. This is wonderful. Let me talk to our broker. You call the broker, and they're selling Blue Cross, Blue Shield of Florida. I can tell you where that call goes. Now, if I'm the broker, and I'm not a broker, but if I'm the advisor. No,
I know where this is going.
But here's what I want to say. If you make that, where that thing dies is, hey, Bob, you don't want to do that. This is working good. Okay. And then Bob's back to answer the 400 emails he missed while you were taking time that day meeting with him. And that's the problem. So you need to find a good advisor. We can help you with that, but there are not a lot of them out there, because I got to tell you, it's a good gig. You just referenced some clinician that left taking care and saving lives to go in this business. You can make a lot of money sitting there meeting with a client once or twice a year, delivering an increase. And when you deliver the increase, guess who gets a raise? I do.
Yeah, I'll tell you, the first person whoever in my staff is listening on the podcast, they will. This will be an eye opener for them, because I've been talking about this for years, and it's important to practice what you preach. And I've been saying this for a long time. So, like I said, we'll speak. So I want to hear. You mentioned at one point there were 6 points that you and Mr. Murphy came up with, but I would like to hear from you the top 3 basic initiatives that you would love to see enacted, whether it be what's going to happen in in the next election or whatever, but the top 3 initiatives that you'd like to see that would literally change U.S. healthcare delivery.
All right, that's a tough. I know you said something about it. I told you I'm not reading any of that stuff till you ask me. So I'm supposedly better on my feet. Of course, the audience will have to decide that. But
well, you have so many. So what are 3 that jump out at you?
Well, I'll tell you. I mean, this is a complex issue.
Right.
And so what you asked me is very difficult to answer. I tell you what I'd like to do, if I can have the ability to, I'll share all 6. I'm going to name them, and then I'm going to tell you the top 3. How about that? Because I think that would help your audience.
Okay. All right. Well, you got to fire them off, because we start losing people, I think, after about 25 minutes.
I got you. So the 6 deficiencies we identified were embedded conflicts of interest, i.e. the cartel that I described earlier. The lack of cost and quality transparency, the ability for an employee at an employer to find out what something's going to cost. Okay. Number 3, fraud, waste, and abuse, medical billing errors. 99% of all hospital bills are wrong. And I can show you my wife's bill. I can go over this. I'm blue in the face. Number 4, the traditional PPO discount game. You might have heard of a charge master before at a hospital, and they get behind the scenes and, hey, how about our charge master is 9 million % of Medicare, and we'll give you a 50% discount. Well, a 50% discount off something that costs $1, they charge $199 for, is not a good deal. The pharmaceutical shell game. Oh my gosh, that's
the PBMs.
Yep. And the lack of information and data, the ability for an employer to find out what the heck is going on with their health plan, because they can't. I'm dealing with one right now.
But they have to care. And I'm telling you, that has been I went to the largest Hispanic-owned company in the country, so people can look up who that is, okay? They're they're good people, all right? Took care of a family member. And I'm telling you, the CEO loved this. The CEO loved what we were doing with this direct walk-in orthopedic care but that it stopped right there. All right. And that is the problem, is that the employer has to care to the point to look at the data and say, you know what, I'm willing to make a change. And I can tell you, because I've gone for years to all the Chamber of Commerce meetings. So we imagine a surgeon, sometimes in scrubs, showing up at a Chamber of Commerce meeting. Why would a surgeon do that?
Well, he cares, and he wants to change.
Well, I definitely care. But I understood a lot of the points you made, which is why. So I'm going to do a shameless plug for my book. I think you know about it, Carl. I discussed pretty much every point you mentioned. There's a whole 3 pages in here about pharmacy benefit managers, and people worry about the cost of drugs. So I love those 6 points. You are the first guest to give 6, not 3 points. I love it.
All right. Well, I'm gonna cover the 3 real quick that I think are most critical. But no. And by the way, anytime you want to do something together, you call me and I'll jump on a plane and we'll go get it done, man, because I'm telling you, and we got Mitigate partners down in Florida, nobody in South Florida at the moment, but more southwest Gulf Coast, Central Florida. But anyway, we can help you, but you got to have both. That's what I'm trying to say, Dr. D. I've taught, you know what direct primary care is, DPC?
Yeah.
I mean, I've spoken at many of their conferences. The doctors, as you know, are a lot smarter than me. I mean, y'all got an MD and 900 years of education. I'm a lowly old nobody, 4 years of college.
Listen, you need a lot of smart people to disrupt healthcare.
Right.
It can't be all. Yeah.
I know, but what do I know? So the doctors go out and talk to these employers, and then just the example I gave you, they get shut down and they're done. So it takes both of us.
I've experienced it many times.
You have to partner with a benefits advisor and go together. We have some stories that are unbelievable that have been shared across America on all the national stages. So anyway, the embedded conflicts of interest, you got to eliminate it. You got to remove them. The way you do that is you eliminate the middleman. You get rid of them. You don't need most of them. You do not need them. That's number 1. Okay. You do that real quick. The post you and I are on together, DeSoto Memorial Hospital hired us, myself and Murphy. And in 1 year, with Dr. Gross's help, the direct primary care doctor who brought us there, and they put in direct primary care at a hospital. Think about that for a minute. That never happens. Okay.
Yeah, no, you're right.
But I mean, no hospital does that because they want fee for service docs and they own docs. So the point was, in 1 year, by kicking one of the BUCAs, Blue Cross United Cigna and Humana, I'm not going to say it in the public audience one-on-one, I could, but kick one of them to the curb, kick one of the largest PBMs to the curb in the country.
Wow.
And their network. And in 1 year, they saved 1.2 million or 54%. So you folks out there listening, and you don't think there's a lot of money in this business, you're crazy. Eliminate the middles, and that's 157 employees, Dr. Badia, 157 employees. Okay. All right. Number 2 is a lack of cost and quality transparency data. if I look up Dr. Badia, I don't know how many hand surgeries he does a year. He might tell me. I ought to be able to know that. My son had a major jaw surgery on May 25th at Emory Hospital, which, by the way, is a stellar hospital.
It is.
And the doctor that took care of my son, 77 years old, Dr. Badia, he does 150 of these surgeries a year and has for 40 years. Do you think he's pretty good at his craft? I would say so. Here's the point. What if you go to hand surgeon that does 2 a year? Are they going to be as good as Dr. Badia? But no one can find it out. We have a nurse navigation team that finds that out for that member. That's number 2. Number 3, I mean, it's a cross between the fraud, waste, and abuse medical billing errors. I mean, the stuff, my wife had a laparoscopic appendectomy. It was $29,984, and there were $10,696 of billing errors on the bill that United Healthcare paid. I'm glad to put it up and show it to you. Here's my point on all that, okay? That's a problem. Yeah. And then United Healthcare pays a discount off of the 29 grand when it should have been paid off of 19 grand. So that's a real issue. And then the discount game that's a part of that too. 29 grand for laparoscopic appendectomy? Really? And the doctor only made $2,000, and he was the most important part in the whole thing. So
he would have made less than that in Florida for the most part, to be honest. So,
well, hey, y'all aren't paying state taxes. I don't want to hear it.
That's true. You're right about that's why they're coming here in droves. So pay attention, New York State, where I expanded my practice back. I operated on a patient in New York City last week. So people think I'm crazy. I'm actually been going the other way. But yeah, there's so many factors here. You're right. So I'm going to give you my 3. Carl, in a nutshell,
well, hey, I didn't ask, but go ahead.
No, I give every podcast I give my 3 because I want to drill this in. So I think, and you talk about middlemen, I think we need oversight, not authorization. Meaning, don't put barriers in every decision that a physician makes, because each of those barriers, it leads to increased time in getting a resolution and cost. Right. So just have oversight, right? Just like they do with TSA. You pull out somebody every once in a while and make sure, because you cannot have this cog in a wheel. The other thing is there's too much to know in medicine nowadays. You got to see the right specialist at the right time. Okay. That saves a lot of money. Our system, we did this whole thing with the gatekeeper. Primary care doctors are too busy to be doing that. Okay. Let them keep us healthy and pick up things early, okay? And then public education. That's the last one. That's why I wrote a book, Healthcare from the Trenches. That's why I have the podcast. That's why I have, brilliant people like you on the show. And I look forward to really doing more with you, Carl.
It's a great point on the direct primary care, Dr. Badia. And the foundation of a good employer-built health plan is direct primary care. Yes. Not a fee-for-service model, 100%. And that's why that's been such a movement. It's moving slowly, but it's moving. And I tell you, every one of the plans we put in, they save a lot of money because it's the first time ever they can sit with a doctor for 30 minutes to an hour, and the waiting room's got nobody in it. Unlike my dad's waiting room, by the time he retired, there's 50 people in here. Rattle, rattle, here comes the cattle, man. It was crazy.
Well, I think things are going to change. I know I'll see it in my lifetime. I have teenagers, and I'm hoping that what we're seeing right now is not sustainable. So we'll be in touch, and tell people about our discussion, and let's share this. Those of you who are listening, please share it. When you hit like, that's wonderful. But Carl and I don't have big egos. What we're interested is these ideas being spread. So please share it. And look, I'd love to hear from my friends at Blue Cross. Maybe this will challenge them to kind of actually sit down with me.
Yeah, hey, tell them to come on and listen. I'm glad to be there with you. You tell them that they better pack a breakfast, lunch, and dinner. That's all.
All right, Carl. Well, we'll be on. Thanks, everyone, for listening in. Our show went way over. Why? Because these are the really disruptive ideas that we need to enact. So see you.
Whoa. Hold on. I want to say one thing before you do that. No.
Uh-oh.
They're not disruptive. Here's the problem, Dr. D, and this is where everyone needs a paradigm shift. Somebody says, "Oh, Carl, you mitigate folks. Y'all are disruptors." How can doing the right thing be considered disruptive? We don't need to disrupt healthcare. We need